Hi there, I'm Dr. Brad Booth, and I'm a forensic psychiatrist. I was a former program director and have an interest in communication skills. This is used extensively in psychiatry and was developed with the Royal College, looking at are residents able to do a structured and therapeutic interview while still gathering all of the information. In psychiatry, the standard interview is a 50-minute interview, and the STACER is structured around that. And so it involves usually with a real patient having the resident or learner do that 50-minute interview, and then the supervisor or preceptor will be either in the room with the patient and the resident, or the supervisor may be behind a glass pane with a one-way mirror. We actually use the STACER as well sometimes with groups, so we would have a group of residents in the other room along with a supervisor watching one resident do a STACER. The format of this STACER is quite formalized and goes through the main components of a psychiatric history, which overlaps with medical history. So an introduction of the basics, establishing rapport, establishing the structure of the interview, making sure that the patient has an opportunity to get into their reason that they're seeing you, so the HPI, and after a certain amount of time, really focusing that interaction so that the most clinical data can be obtained in the short 50 minutes that are available. As part of that as well, the resident is doing the mental status examination and coming up with a differential diagnosis. At the end of that interview, 50-minute interview, the resident has an opportunity to gather their thoughts and then present the patient, including a preferred and differential diagnosis, as well as an initial treatment plan. So the STACER very formally sort of outlines all of the stages of that medical interaction, and within each of the stages sort of highlights the important pieces of that history taking, ensuring that they've done the important parts of that. And as well, it focuses on the communicator role, working with the patient, sometimes who may not necessarily be very organized. So a lot of benefits to this structured evaluation. So basically, after the 50-minute interview and the presentation by the resident, the supervisor can then elicit some of the understanding of the patient. But then the next step is really to, in a formal way with the STACER form, go through and score the resident in terms of how they're doing, both their strengths and their weaknesses. And at the end of that, it's fed back to the resident in a written form, so they can add that to their portfolio. In addition, there's sort of a summary of what are the strengths and the weaknesses. And the next step, obviously, is to come up with a plan to identify any of the deficiencies that are apparent in the evaluation. And this type of assessment, we find it helpful because we can use it both formatively and summatively. And so throughout training, there's kind of easier forms of the STACER kind of geared towards earlier levels of training and simpler patients. And then later in training, residents will do more complex patients with higher standards required. The nice thing is that although they have to become proficient in it, they can do as many as required in order to reach that proficiency. And after each interaction, the residents are encouraged to go out and work on that particular type of patient or that deficit that comes up, and then to have another evaluation. At the end of training, the Royal College requires that they do at least 2 of these successfully, although there's a built-in practice because the residents have to do often a number of these to build that skill. So the STACER is, again, just one of many tools that are available in order to, in a very structured way, evaluate the communication skills that are expected of all physicians. And although the one with the Royal College through psychiatry is geared towards psychiatric interviews, in fact, it probably could be applied to really any medical interaction, because it's really focused on that communication piece. There are a number of other tools that are available, including the Calgary, Cambridge, and in fact, the Royal College may have STACERs that are specifically made for areas outside of psychiatry. Although in psychiatry the sort of ideal STACER is 50 minutes, in fact it's really meant to be applied throughout training and really built into daily patient encounters, so that a supervisor, for example on consult liaison, may go in for a 20-minute patient interaction and would be able to score many components of the STACER. And so the time frame shouldn't be prohibitive, and it should be built into general patient care ideally as a formative tool. As a summative tool, we do have a lot of structure at the end of training required by the Royal College in terms of how that process must go, but as a formative tool throughout training,